Today we are diving into an important topic, vitamin D, also known as sunshine vitamin. You have probably heard a lot about it on social media. Some of it helpful and some of it confusing. Don't worry, I am here to simplify it for you. In today's video, we will cover what vitamin D does, where to get it, its role in health and disease, and when supplements are needed and how to use them wisely. So let us get started. Vitamin D is a fat-soluble vitamin that plays a role far beyond just bone health. Here is what it does. Helps your body absorb calcium and phosphorus and deposit it in bones. Basically, it keeps your bone and teeth strong. It strengthens your immune system to fight infections and reduce inflammation. It supports blood pressure regulation and prevents fat buildup in blood vessels, reducing the risk of blockages and clots. It improves insulin secretion and sensitivity, thereby aiding in blood sugar control. It supports nerve function and may lower the risk of depression and age-related memory loss. Some studies suggest it slows cancer growth and spread, though more research is needed. There are some symptoms which are proven without doubt due to vitamin D deficiency. These are weakening of bones resulting in rickets in children and osteomalacia in adults. In elderly, it contributes to frequent falls due to reduced muscle strength and balance. These frequent falls increases the risk of fractures. Frequent muscle cramps and respiratory infections could be indicative of possible vitamin D deficiency. There are some other symptoms. While not conclusively proven yet, vitamin D deficiency is thought to be the reason behind these symptoms. These are fatigue, mood disorders like depression, hair loss, slow wound healing, and metabolic disturbances such as weight gain. The recommended daily allowance is 600 IU for adults. For older adults, 800 IU is recommended. However, some experts believe these RDA should be higher due to reduced sun exposure in today's lifestyles. You can get vitamin D3 from three main sources. Number one is sunlight. Your skin produces vitamin D when exposed to ultraviolet B rays. You should aim for 10 to 30 minutes of midday sun on your face, neck, arms and lower legs, which makes approximately 25% body surface at least 3 times a week. Overall time needed depends on your skin tone and season. Second is diet. Fatty fish like salmon and mackerel, liver, egg yolk and sun-exposed mushrooms are natural sources of vitamin D. Fortified foods such as milk, cereals and juices are also helpful in fulfilling your daily requirements. From above, it is not difficult to guess that vegetarians and people who spend a lot of time indoors, that is, are less exposed to sun, are at a higher risk of deficiency. Vitamin D supplements come in two forms. D2-ergocalciferol, which is sourced from plants, and vitamin D3, that is cholecalciferol, which is sourced from animals. Cholecalciferol has been found more effective in raising and maintaining levels of vitamin D in your body. Vitamin D levels are measured in nanogram per milliliter. Levels of 30 to 100 nanogram per milliliter are considered adequate or sufficient. Levels 20 to 29 nanogram per ml are considered insufficient. People with their vitamin D in this range should consider more sunlight, food or supplements. Less than 20 nanogram per ml are deficient and usually require high doses of vitamin D, which should be taken only under medical supervision. Depending on individual levels and physical condition, your doctor may recommend 2 to 4,000 IU per day or 60,000 IU per week for 8 to 12 weeks, followed by a maintenance dose of 1 to 2,000 IU per day. Now let us separate what we know from what we are still learning. There are certain conditions where favorable evidence is present. First is prevention from falls and fractures in elderly. In older adults with insufficient vitamin D levels, supplementation reduces the risk of falls and fractures. No additional benefit has been observed beyond levels of 30 nanogram per ml. Adequate vitamin D levels are linked to better prevention and recovery from respiratory infections, including COVID-19. Supplementations with vitamin D may reduce the risk of preeclampsia, preterm birth, and possibly gestational diabetes, especially in women with insufficient levels. Experts suggest daily doses of 1 to 4,000 IU may improve outcomes. However, jury is still out. Then there are some conditions where evidence is still emerging and nothing can be said conclusively. In that we have number 1, cancer. Maintaining sufficient vitamin D levels may benefit individuals with colorectal or breast cancer. However, supplementation has not demonstrated preventive effect against cancer. Some studies suggest a potential preventive effect in autoimmune diseases, particularly at serum levels around 40 nanogram, but more research is needed. Early research indicates that supplementation may help prevent progression of prediabetes to diabetes in some subset of prediabetics, but further studies are required to confirm these findings. There is very weak evidence for its usefulness in heart health, type 2 diabetes, and brain health. So, it is very important to note that based on current evidence, vitamin D supplementations does not provide additional benefits if serum levels are already sufficient. Unnecessary or excessive intake of vitamin D does not offer any extra advantage and can even be harmful. Daily supplements can help pregnant or breastfeeding women, older adults with limited sun exposure, people with conditions affecting vitamin B absorption or metabolism such as liver or kidney diseases, and those with lab-confirmed insufficiency. One should aim for levels between 30 to 50 nanogram per ml. Higher levels offer no added benefit. Vitamin D is a fat-soluble vitamin, therefore excess intake can build up in your body causing kidney stones, calcium deposits in arteries, increasing heart disease risk. Paradoxically, excessive vitamin D levels may weaken your bone and increase the risk of fractures. Therefore, stick to RDA unless a doctor advises otherwise. Vitamin D is essential for overall health. While supplements are helpful for those with low levels, they are not magic cure for every ailment as projected in social media. Focus on natural sources and take supplements only when necessary. And that is all for today. Don't forget to subscribe to the channel and hit the notification bell. Take care, and I will see you soon in the next video.